Science has made tremendous strides in determining who's at risk of developing certain types of cancer. Certain genes show up in women who are more likely to have breast cancer. Knowing there's a risk is one thing, but how do you manage cancer risk? Lorene Cachola is here with an explanation.
Lainey Turner colors while her mother Amber watches. It's something that might not have happened if things had turned out differently.
Well, I can say, I guess, that risk management saved my life. I wouldn't be sitting here today if I weren't concerned with it.
That's because during a breast self-exam almost 3 years ago, Amber found a lump that turned out to be cancerous. In addition, her mother had survived 2 different types of breast cancer. So Amber went to a genetics counselor at the Baptist Women's Health Center to find out just what her risk of reoccurrence would be and help her decide what to do.
So I made the decision to go ahead and have the bilateral mastectomy and some reconstructive surgery at the same time. And I went through about a year of chemotherapy and did about the most intensive that I could, knowing that risk that I had.
There are 3 basic levels of cancer risk. Average risk, a person with no major risk factors, no strong family history. That carries about a 12% lifetime risk for breast cancer. Moderate, possibly some family history, early menstruation, no children, a 20 to 30% lifetime risk. High, women with a hereditary risk that can have a 50 to 85% risk of breast cancer in their lifetimes. In many cases, that risk is increased by mutations in the BRCA1 or BRCA2 genes. Doctors say mutations in those genes are often responsible for cancer. In Amber's case, genetic risk management helped her determine her course of treatment. And even though she is cancer-free now, it helps determine the level and timing of her future screenings. She was also concerned about another future.
And my daughter, since I'm positive for this gene, she has a 50-50 chance of carrying this gene. And the biggest part of that meeting with the counselor was him telling me not to worry, that probably by the time she's an adult and has to be tested, that there will be a vaccine for this anyway.
Amber's counselor says risk assessment starts with information.
The process to do a risk evaluation or a risk assessment is to first of all take a detailed 3-generation family history, getting information about cancer diagnoses, the ages that people were diagnosed, the types of cancers that they had, and then also to ask information about personal history.
Fowler says the emotional impact of any cancer risk is an important part of genetic counseling. For Amber Turner, knowing her risk lets her focus on other things, like the children's book she wrote, in part, while she was being treated. That book, called Sway, is due to be published in 2012. Fowler says any women interested in knowing their own cancer risk can contact the Breast Risk Management Center in the Baptist Women's Health Center at 901-226-0810. For Smart Medicine, I'm Lorene Cachola.